Hi, thank you for watching our presentation. My name is Michael Gerjoy from the University of Toronto, and I'm presenting work by Claire Lee, Noel Lim, and myself on detecting a proxy for potential comorbid ADHD in people reporting anxiety symptoms from social media data. So many patients with anxiety symptoms later get an ADHD diagnosis. We show that social media data can predict ADHD concerns for patients who report anxiety symptoms using transformer architectures. And we show, by the way, that classical methods that are keyword-based, so naive Bayes, logistic regression, just do not work for that task. The transformer model that we use picks up something that keyword-based methods just cannot. For accomplishing this, we introduce a trick to obtain the data set. Basically, what we say is we'll scrape data from social media and we'll pay attention to the Reddit users who started out posting in the anxiety subreddit and then either did or did not continue on to also posting on the ADHD subreddit. We censor the part where they post on the ADHD subreddit, and that way we have data just from the anxiety subreddit, which we can classify as this users will in the future post on the ADHD versus they won't. We visualize the explanations for the classifier outputs in order to explore more why it is that the classifier classifies some people as will post an ADHD and some as will not, at least under the same username. A broader point we want to make is that there are millions of data points on social media of patients and just people discussing their symptoms. This is compared to thousands, possibly less, in individual studies or in a physician's practice. So we think that there is an opportunity here to obtain a much richer understanding of how diagnosis happen, also a much richer understanding of the nosology of kind of clusters of symptoms like ADHD and anxiety, where really it's really difficult to say anything because a lot of the time, all the information that you have is patients talking about themselves, and there's just not a lot of that information in either an individual's physician or clinician practice, or in even a study. So up to 50% of adults with ADHD may also have an anxiety disorder under some definition. The other way, up to 28% of adults diagnosed with anxiety are also diagnosed with ADHD. So those are very highly comorbid. Patients often present with anxiety and then are diagnosed with ADHD for various reasons. Part of it has to do with how clinicians practice, for example. Part of it has to do with the complex definition and criteria for the diagnosis. There's a lot of things that are going on, but that's the result. So what do we want to do? So we want to, again, predict which patient or which person who is concerned about anxiety will also start posting about being concerned with ADHD. So there are several potential applications. So the one we are focusing on here is understanding how ADHD and anxiety diagnosis work and obtaining a richer understanding of the people who get an ADHD diagnosis, people who get an anxiety diagnosis, and people who get an anxiety diagnosis, but that or are concerned about anxiety and then become also concerned with ADHD. With more work, one might imagine that this kind of work might lead, with appropriate safeguards, to more timely diagnosis of ADHD. Again, with more work, one might imagine automated suggestions that the patient might like to be examined for ADHD. Of course, that creates all sorts of issues where this needs to be done carefully and with consent. So again, the idea, we classify posts by just in the anxiety subreddit by people who have not posted in the ADHD subreddit, but might in the future. And we try to separate out those two sets of posters. And here's what we get. So the accuracy with a 50% base rate for logistic regression and for naive Bayes is basically 50%, slightly more. So basically, individual keyword-based methods do not work for this task. On the other hand, what we found after actually 2 years is that Roberta does work pretty well. So, of course, not perfectly, but we get substantially better performance that indicates that Roberta is picking up on something interesting there. So 76% correct. One might argue that this is one of those this is a little bit vague, but one of those scaling law things in action. Don't want to make too strong of a claim here. So our next step is to take this classifier, which clearly picked up on something, so picked up on some interesting differences between posts in the anxiety subreddit from people who will and will not go on to post in ADHD under the same username. So we started visualizing the outputs of those classifiers. So what we had done is just mask out every individual word, see how that affects the output of the classifier, and mask out every phrase and see how that affects the output of the classifier, and then highlight the words and phrases that for which masking out resulted in the largest change in the output of the classifier. So a fuller analysis of that is forthcoming. So in conclusion, so you can use the chronology of posts to detect and explain comorbidity, or try to. Transformers sometimes work much better than classical techniques. I think this is one of those situations that's actually unusual for this kind of data set. In our opinion, there are huge opportunities in mining social media data for insights about complex disease, and in particular, disease where most of the information about it comes from just people talking about what is happening to them. It's not the kind of situation where you could do a blood test or something. You can, but not going to be super informative. Thank you very much for listening to our presentation. Email us, tweet at us, accent us. Thank you very much.